Question 1. Rhinodine receptor mutation. A man closes his eyes, and the examiner notes upward deviation of the eyeballs under the lids. Genetic analysis reveals a mutation in the rhinodine receptor. What is the key physiological abnormality? A. Excessive calcium influx from extracellular fluid. B. Reduced ATP binding to actin-myosin complex. C. Excessive calcium release from sarcoplasmic reticulum in skeletal muscle. D. Defective sodium channel leading to muscle hyperexcitability. Explanation. The rhinodine receptor, RYR1, is a calcium release channel located on the sarcoplasmic reticulum, SR, of skeletal muscle. A mutation here causes excessive calcium release, leading to abnormal muscle contractions. This mechanism is commonly associated with malignant hyperthermia and other myopathies. Question 2. High-altitude physiology. A 28-year-old woman travels from Delhi to Leh, 3,500 meters, and develops symptoms like headache, nausea, and breathlessness. What best explains the initial disturbance and compensatory response? A. Increased barometric pressure causes hyperoxia. B. Decreased alveolar PO stimulates peripheral chemoreceptors, leading to hyperventilation and respiratory alkalosis. C. Decreased alveolar ventilation. D. Reduced oxygen content shifts ODC to the left. Explanation. At high altitudes, barometric pressure drops, reducing alveolar PO. This stimulates peripheral chemoreceptors, carotid aortic bodies, increasing ventilation leading to respiratory alkalosis. This is the initial and fastest response to hypoxia. Question 3. Nerve fiber susceptibility. A person develops loss of pain sensation and tingling in the arm after sleeping with the arm under his head. Which nerve fiber is most affected? A. Fibers are more susceptible to pressure than C fibers. B. C fibers are more susceptible to pressure. C. A and C equally affected. D. C fibers affected first due to being unmyelinated. Explanation. Fibers, large, myelinated, conduct proprioception, vibration, motor function and are more pressure sensitive than C fibers, small, unmyelinated. Pressure blocks large fibers first, hence tingling, paresthesia, and sensory loss occur. Question 4. Absolute refractory period. Which of the following statements about the absolute refractory period is correct? A. Threshold point is at A. B. Absolute refractory period corresponds to interval point B to point D. C. Refractory period extends from point C to E. D. Na influx causes depolarization between point C to E. Explanation. The absolute refractory period is the time during which no new action potential can be generated, no matter the stimulus strength. It coincides with Na channel inactivation, typically from the beginning of depolarization, B, until most Na channels have recovered, D. Question 5. ECG in chest discomfort. QA patient with chest discomfort and palpitations shows ECG changes. What is the most likely diagnosis? A. Acute pericarditis. B. Inferior wall MI. C. Anterolateral wall MI. D. Septal wall MI.
Explanation. Anterolateral MI affects leads V3, V6, I, AVL, and is associated with symptoms like palpitations, chest pain, and tachycardia. Without the actual ECG, the clinical presentation aligns best with this. Question 6. Axon diameter and conduction. Which of the following statements is true regarding the effect of increased axon diameter? A. Decreased conduction velocity. B. Decreased sodium influx. C. Increased conduction velocity. D. Increased membrane resistance. Explanation. Larger axon diameter, less internal resistance, faster conduction of action potentials. This principle is used in saltatory conduction and in myelinated neurons. Question 7. Myasthenia gravis. A person has muscle weakness, ptosis, drooping eyelid, worsens as day progresses. Most likely cause. A. Antibody against ARC receptor at postsynaptic area. B. Increased end plate potential. C. Decreased calcium influx at presynaptic terminal. D. Both B and C. Explanation. Myasthenia gravis is an autoimmune disorder where antibodies attack nicotinic ARC receptors, reducing neuromuscular transmission. Classic features: fluctuating muscle weakness, ptosis, better in morning, worsens with activity. Question 8. ECG with irregular rhythm. A hypertensive male has dizziness, palpitations. ECG shows irregular rhythm, no P waves. JVP findings: A. Hyperacute A waves. B. Absent A waves. C. Prominent V waves. D. Slow Y descent. Explanation. In atrial fibrillation, atria do not contract, A wave disappears in the JVP. The rhythm is irregular and P waves are absent on ECG. Question 9. Cold-induced dyspnea. A person exercising in cold weather develops breathlessness. Most likely physiological cause. A. Sympathetic-induced bronchoconstriction. B. Sympathetic stimulation causes histamine release. C. Cold-induced airway hyperresponsiveness causing reflex bronchoconstriction. D. Vagal tone causes bronchodilation. Explanation. Cold air triggers airway hyperresponsiveness, especially in exercise-induced asthma. This leads to reflex bronchoconstriction, causing dyspnea and wheezing. Question 10. Spinal cord injury, lower limb paralysis. A patient is paralyzed in both lower limbs with no upper limb involvement. Likely site of injury: A. C5. B. T12. C. L1. D. T4. Explanation. Injury at thoracic levels, T12, causes paraplegia. Upper limbs are unaffected as cervical spinal cord remains intact. Below T1 only lower limb tracts are involved. Question 11. Head injury and language comprehension. A patient cannot understand or explain things post-head injury. Which brain area is affected? A. Precentral gyrus. B. Broca's area. C. Wernicke's area. D. Premotor cortex. Explanation. Wernicke's area is involved in language comprehension. Its damage causes fluent aphasia, patient can speak but words lack meaning, and comprehension is lost. Broca's area affects speech production.